Hello, everyone, and welcome to Joint Ventures, where we talk about the latest medical news from an orthopedic perspective. I'm your host for this episode, Dr. Jeffrey Carlson from Orthopedic and Spine Center in Newport News, Virginia. I'm an orthopedic surgeon with a focus on spine surgery. Today, we're covering a topic that almost every patient will encounter at some point, an MRI scan. Magnetic resonance imaging is one of the most valuable diagnostic tools we have in orthopedics, neurology, cardiology, you name it. It's safe, powerful, and incredibly detailed when handled correctly. But along with its benefits comes a critical truth. MRI scan safety is not optional. The MRI's magnet is always on, 24 hours a day, 7 days a week. It can pull metal objects across a room in less than a second. That means a simple lapse in protocol can turn everyday objects into dangerous projectiles. Recently, a tragic event in Long Island made national headlines. On July 16, 2025, at Nassau Open MRI in Westbury, a 61-year-old wearing a 20-pound weight training chain entered the scan room during his wife's MRI scan. The chain was yanked toward the magnet with enough force to cause fatal injuries. According to reports, the family had even mentioned the chain beforehand, yet it was never removed, and the technologist allegedly allowed him in the scan room. This tragedy is a stark reminder why safety protocols exist and why they must be followed without exception. At OSC, MRI scan safety isn't just a checklist, it's a culture. From the moment the scan is ordered, our process is designed to protect patients, staff, and visitors. Screening is thorough, zones are enforced, and no one enters the scan room without clearance. For patients, here's what that means. The MRI scan machine is not just a camera. It's a massive, always-on magnet. Even small items like hairpins, hearing aids, or forgotten credit card can become dangerous or be destroyed. Implants, tattoos, cosmetics, and even medication patches can matter. That's why we ask so many questions before your scan. Most MRI scan incidents aren't caused by faulty equipment. They're caused by human error. Over-familiarity, rushing, or assuming this one time is fine can be deadly mindsets. That's why our technologists train continuously, review procedures often, and uphold a never-cut-corner standard. To give you a first-hand perspective, I've invited Holly Marshall, one of our highly trained senior MRI scan technologists here at OSC. She'll walk us through the critical elements of MRI scan safety and what every patient and provider should know.
Hi, my name is Holly Marshall, and I'm one of the senior techs here at the Open MRI Center. Well, the MRI stands for magnetic resonance imaging. It's a very high field, powerful magnet. So if you have any kind of metallic device on you that is magnetic, the machine can pull it off. If it is a very large object, it can harm you as the patient. It can get stuck to the machine and harm the machine. If they're very, very small pieces, they can get in the machine without us knowing and actually cause artifacts on your scan. They can show up on other people's scans as well. And bringing the system down to clean it off is just not something that's feasible to do. Well, the American College of Radiology sets guidelines to keep these safety measures and risks at a minimum. They have 4 zones that we're supposed to adhere to. Zone 1 is your general public. Zone 2 are people there for imaging procedures. Zone 3 is actual MRI patients that have been screened for safety. And then Zone 4 is the actual MRI room itself. When you call and make your appointment, you will be asked to answer the safety protocol questions. When you come in for your MRI, the tech will actually go over those with you again, and probably several times before you enter the room. It is important that we know all electronic devices, any metal that you have on, any implants that you have. The magnet can actually not just be magnetized and pull these things off or move them within your body, but it can disrupt the way they function. For instance, pacemakers. The last thing you want is your pacemaker to stop working properly. The MRI room itself is designed, the actual space around the magnet is based on the magnetic field. So as soon as you enter the room, you have already been exposed to it. A magnetic field cannot just go away. You can turn the machine off, but it's always there. So once you've entered the room, even if the scan is not going on, you are still exposed to that. So it is always mandatory that you be screened before you enter the room, even if there is not a patient on the table. With the magnetic field and the strength of the magnet, then the more mass you have to those metallic parts and the closer they get to the scanner, the faster they will move. So it becomes very dangerous as you get closer to the magnet if you have those things on you or in you. A very common misconception with an MRI is that they all work the same. Different magnets are different strengths. They have different spatial gradients, many factors which create a difference in how these magnetic components will act when they're in the scanner. Just because someone has worn jewelry or certain clothing for one particular magnet at this facility does not mean they can do it at a different facility. OSC being an open MRI, we have a vertical field magnet versus the long tubular bore, which many people are familiar with. Our safety standards are a little different. We have a very high spatial gradient. What is acceptable in most places may not work on our scanner. We just don't take chances. All jewelry must be removed. All clothing down to the underwear will be taken off. There are metallic threading, bobby pins, even what you think is plastic, such as bra hooks or combs in your wig. They are not necessarily all plastic. They could just be coated. And they will be pulled off of you when you get into the magnet. Again, we just don't take those chances. It has to come off. It is our policy. There are no exceptions. Many people believe that you can tape things down. You can. If you were to tape a very small item down, it may not pull into the magnet, but it is still metal. And because we use radio frequency waves and copper wiring, we create a lot of heat. Burning the patient is also a concern. Again, we just don't take chances. It all comes off. There's nothing left to question. We are aware of the recent tragedy in New York, but we cannot say exactly how that happened. We just can assure you that we follow a very strict safety protocol here at OSC. You do have to answer your safety questionnaire. You will be expected to remove all of your clothing, any pain patches, any loose metallic articles. We will go over that with you several times before you go into the room. We just go slow. We answer your questions. We try to explain them. So we are registered techs here at OSC. We do have to keep up our yearly accreditation. It keeps our training up to date so that we are aware of any changes and new protocols that should be followed to keep you safe. Your safety is a very important concern to you. It is to us as well. If you have questions, please ask them. We will go over them with you. We will explain to you why we do what we do. It may seem very redundant, but bottom line is, it is for your safety. Not everything will be an issue, but we just don't leave that up to chance here at OSC.
MRI is one of the most powerful diagnostic tools we have, but it's only as safe as the protocols and people behind it. At OSC, we make safety a priority, from the first screening question to the final image captured. Thanks for joining us for this episode of Joint Ventures, and thank you, Holly, for sharing your experience and perspective. Remember, the strongest magnet in the room isn't just in the machine, it's the pull towards doing things right every single time. Stay informed, stay safe, and we'll see you next time.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.